Hey there, and welcome to the Agentic Voice Podcast. My name is Kristen Ruiz, and I'm here with my lovely co-host, Dr. Geneva Main, and our special guest for today, Gwen Merrick. In today's episode, we are discussing a trauma-informed toolkit for voice professionals. Oh, and by the way, don't forget to follow and subscribe to our channels on Instagram, YouTube, and your favorite podcast platform. And drop us a note. Let us know what you'd like to hear more about. All right, so if you are not familiar with Gwen's work, let me introduce you to her. Gwen is a speech-language pathologist and a registered psychotherapist. She spent the first half of her career as an SLP working in brain injury rehab, acute care, and voice and swallowing disorders. The fascinating and complex relationship between the voice and emotions inspired her to become a psychotherapist. Gwen now has a private practice in Toronto providing psychotherapy and voice therapy. Gwen loves to meet her clients where they are, and together they create a safer, supportive space for healing, embracing the voice, and the exploration of what it means to be human. So Gwen, thank you so much for joining us for today.
Thank you. It's great to be here.
So before we get into the heart of our discussion today, we usually like to start with what's new and what's good, where we share about whatever is really cool or interesting in our personal or professional lives. I usually start, and I'll say that my life is wonderfully boring right now.
That was a well-earned thing.
Yes, I'm just like
Privilege.
I'm like enjoying just the self-care right now because I've had seasons of just go, and I'm coming out of that and really enjoying taking care of myself and cooking vegetarian like I shared last time, and consuming tons of like podcasts and YouTube channels about health and inflammation and all this good stuff, and feels really good to be doing that.
That sounds like another podcast.
Absolutely. And you know what's funny? Because I had tried like vegan, vegetarian years ago before I had like a health crisis, and I gave it up, and it felt so difficult before, like the last time. And now it feels effortless. I don't know if it's like a learning curve I needed to go through or what, but like I'm not throwing out stuff I've cooked like I used to. It all tastes good to me, and like, yeah, I'm just surprised at how effortless it feels. Because that was not my mindset before. Maybe it was a mind thing. I don't know.
It could be. I think there's also more available, both in terms of like, I'm so grateful for, the Instagram, vegan cooks and stuff who put things on to make it so accessible, easy. So I'm right there with you. But I think everything is available now too. Where
Yes.
before, like, and if you said it years ago, it's like you had three heads, and now the plant-based life is making more sense to people.
Yes.
I can fully relate because I was the person 12 years ago. They're like, what?
Are you vegan, vegetarian?
I'm vegan. Yeah, I've been
Awesome.
vegan for about 12 years and vegetarian since 91.
Yes, I was vegetarian for many years and I tried vegan, but it didn't stick. Probably because like not a lot of people in my family were supportive of it. And then I got sick, like I said. But like I tried recently fava beans. I'm just trying stuff. And like part of it, it just like it looks funny. Part of me is like, it looks funny. I don't know. But like I made a whole dish, no recipe. I just kind of like flavored it and sauteed them in vegetables. And I was eating that for lunch today. I'm like, this is so good.
Yeah.
I'm like, you can't mess up when it's vegetarian. It feels that way to me because I really feel like the flavor of food comes from plants. It doesn't
Yeah.
come from me. It comes from plants. Meat adds like satiety and things like that, but the flavor comes from plants. So I'm not messing up, which is cool.
Well, that's very exciting. I want to talk to you more just to hear how your health benefits what you're noticing.
Cool.
Love this.
So what's new and what's good with you, Gwen?
What is new and what's good? So you're coming into you're in a bit of a season of calm and self-care. I feel like I'm coming into the season of spring. Everything is starting to really, grow and expand for me. And one of the fascinating things is like having, you said, oh, it's my first podcast, first time on. I'm also like a recovering loner. So I am super grateful for connection and community and professional, because I think my hospital-based career was quite isolated. So since I've left, and especially since I did a psychedelic assisted therapy retreat last fall. It was outstanding. I used to say, oh, transformational. It was transformational.
Wow.
So since that, I feel like my ideas are just absolutely exploding. I want to become a psychedelic assisted therapy integration therapist to add to my skill set. I've just started the EMDR, eye movement desensitization reprocessing therapy training, which is fascinating. And I can't wait to see how that can be applied to voice disorders.
And for our listeners, that's a trauma-specific intervention, right?
Yes. Yeah. And what else has been exciting? Oh, yes, I am starting sort of a healthcare huddle, which will be a new format of healthcare and professional development support for people who are in the healthcare sector. So anyone from custodians to clinicians, to build a community where people can come and be acknowledged and supported and resourced for greater resilience. So that's on the horizon.
Nice.
Yeah.
That is awesome.
So spring is exploding in my life.
I see a few more podcast episodes coming up for us. I think talking about the psychedelics is very interesting, and the vegan component. All right, so we'll have you back a couple more times, I imagine.
I'd love
What's
to.
up with you, Kristen?
You were both talking about seasons. I think, using that idea, I think I'm in the season of sewing right now, both in very physical ways and then in other kinds of like cognitive idea levels. Like for instance, talking about vegetarianism. So I've been vegetarian for I don't know, maybe 8 years or so, and then vegan more recently. And so started making my own cheeses and butters and all the stuff because it's so easy. And then I started, this was my very first time planting things from seed. So they just sprouted this past week. And so they're little tiny little nuggets of things. But I have a couple different lettuces and some herbs and things like that. It's so easy. I never did it because it always sounded so like, well, that's for people of the earth, and I was a person of dialing and ordering online. So, but watching them like pop up through, and we have a little spare room where we got some grow lights. So we kind of have a little grow wall where we're kind of like trying out some stuff. It's so cute. So that's been one thing. But at the same time, there's other things that I feel like making those investments to really study and to create, and both professionally and personally. So I feel like that's the season that I'm in of sowing and nurturing with the idea that there's going to be a harvest coming. So there's some faith faith.
I wish I lived closer to you so I could, pop over for some lettuce.
Right. Amazing.
Guess who lives close to her?
I know, Janita. You're going to come over. We're going to have a beautiful feast.
Yeah, that's awesome. Okay, so I guess we can move into our next segment.
Sure. So in this next segment, we love to talk about, the work and what it means. And so, Gwen, we know that you're an experienced clinician, and we're curious about how you became both an SLP and a psychotherapist. And by the way, it wouldn't be the worst thing to even define, like some of our listeners might not know exactly what a psychotherapist is. So if you could even frame what that is, and just tell us a little bit about how you came to wear both hats and find your niche in this, in your private practice.
Okay, let's see. How can I summarize this? So I've been a speech pathologist for over 20 years and have meandered around between brain injury and acute care, and then really found my home in a voice disorders clinic here in Toronto and loved that job. I mean, I had no idea I would land in voice. I know many of your guests and listeners come from a background of singing. It's the first thing I tell a voice client, like, no, if you're here for singing, it's not me. I have much more of a medical background when it comes to voice care. But But when I found voice, it was like, oh, this is amazing. You can see it. I worked in a clinic where I had access to stroboscopy, so that was always fascinating. So there was the science, there was the art, and then there was the emotion. And the more I got into it and the more I learned, just, I mean, it's obvious now, but just how deep that connection is between the voice and emotion, either because people were coming in with a voice injury, and so they were dealing with the emotional consequences of that, losing their identity, their ability to connect with people, sometimes their source of income, or it was an emotional event that was contributing to their voice issue. I thought, I need more skills. And my life happens quite serendipitously. I often don't look for things, they sort of find me. So I was at a stage in my life when I needed psychotherapy, and psychotherapy is counseling. We don't diagnose, but we can assess and support like a counselor, but we have to belong to a regulated college here in Ontario. So I found Gestalt therapy, and Gestalt it did it for me. I'd been to other therapies, but this landed. So when I decided I wanted to become a psychotherapist, I went to the training institute where I had seen a clinician and went to school for 6 years part-time, and then finished and became a regulated psychotherapist. So then I had a small private practice while I was at the hospital. Then COVID hit. You know what? I actually would say that even before the pandemic hit, I had grown so much at the hospital. I'd been there about 13 years, and I was wondering if maybe I was at my limit. Hilariously, I saw a psychic. She said, yeah, you're going to leave, but it's not now. But when you know, you'll know. Enter a pandemic. And I'm like, oh, this is it. This is the sign. It's time to move out. So for various reasons, around the pandemic, I chose to leave. And I've been in private practice now, offering both speech pathology focused on voice therapy and psychotherapy in my private practice.
Wow.
That's so interesting because, I come from a singer-centric perspective, in my work, but that connection between voice and emotions and identity and the social community in which that voice operates, they're also interconnected and interdependent. So the idea of having the psychotherapy and the voice therapy in the same space just makes a lot of sense because it's everything.
Yeah.
It's physical, it's emotional, it's social, it's all the things. So that, I think that's interesting because then you can get into the nooks and crannies that not everybody else can.
I don't know how similar the credentialing laws are in Canada versus the United States, but can SLPs practice trauma-informed care?
We all know the answer. Trick question. Of course, yes. Because, one of the things I like to think of trauma-informed care, it's really about being human, right? It's how to bring more humanity into what we're doing. And we don't have to have a special license to do that. So, yes. So I like to think of scope of practice like boundaries. And I think of boundaries like getting in a canoe. If we're traveling across somewhere with someone, we get in the canoe. The canoe helps us know where the edges are, helps keep us safe. So I always think about scope of practice as, am I in the canoe or am I out of the canoe? And I know ASHA has guidelines, as do the colleges in Canada, where as long as we are providing education or emotional support or anything that will help empower a client to make decisions around their voice, we are in the canoe.
Nice.
So I feel that is 100% within our scope of practice. I also think it's important that we are there to develop their strengths, right? So that we can empower them to help them identify what skills they still have, what parts of themselves they still have, even though they are going through this challenge. Few ways for us to make sure we stay in the canoe. I like to get people to think about certain questions. So first of all, checking in with ourselves in trauma-informed care. How am I doing? So if I'm coming into my session well-resourced, I'm keeping the canoe balanced. But if I'm coming in carrying a lot of my own trauma or my own issues that I haven't fully processed, I'm starting to destabilize the canoe. So it's really important with trauma-informed care that we are doing our own work. Is that, and I can go
Yeah,
on.
I just wish it was something that was easier to, I guess, disperse to people, because the document that SAMHSA, Substance Abuse and Mental Health Services Administration, created on trauma-informed care is from almost 10 years ago now, or over 10 years ago now. And there's still such a hesitancy. And I feel like if people kind of understood the importance, number one, of taking care of yourself socially, emotionally, mentally, to show up for yourself and your colleagues in your workplace and your clients and patients, it would be a lot easier. The workplace would be a lot easier. You still have people who have, pretty significant challenges, but some of the things I see sometimes when I didn't have a trauma-informed lens, I'd be right there reacting with everybody
Right.
else.
Right.
And now I see it and I'm like, whoo, like not judging it, but understanding what I'm seeing, and that's where you get that very first one, right? Realizing the prevalence and recognizing the signs and symptoms.
Absolutely.
Yeah. So
I
I
love
had,
that you just said that, because one of my questions was like, okay, so let's paint a picture of what does it look like, when you have a trauma-informed lens versus not. But I think you kind of just captured it, is like the meaning-making lens that we can use is more sophisticated, pick up on nuance, and then we'll understand maybe the understand the scenario in a different way. So I'm glad that you said that.
yeah, I
Yeah.
think it gives you a foundation for having compassion, not for just for yourself, but for other people.
100%. It's that question of, when something happens and you think, what's wrong with you?
Hmm.
From a trauma-informed position, it's more about, gosh, I wonder what happened to you.
What an interesting distinction, too. And you see the compassion embedded in the second.
Yeah.
Mhm.
So Kristen and I invited you on the podcast because I heard your talk at the Fall Voice Conference, which was awesome, by the way. 2 snaps.
Oh, thank you.
And I thought your presentation was just brilliant, and it has a few more elements to it than what we are presented through SAMHSA. So can you share with us an overview of trauma-informed care and the elements that you thought were important to add in and why you think they are important?
Absolutely. Sure. And it was lovely to be at Fall Voice. Gosh, that was a gem of a conference. So it was a real privilege and honor to be there, especially with my colleagues, Wind and Allison, who I did this presentation with.
Yes.
So we know SAMHSA, they have their 4 key assumptions around realizing that trauma exists and that we don't know who has suffered trauma or not. So it's best practice to apply trauma-informed care to everybody, to be able to look for those signs. So recognizing signs of trauma, which could look like, we sort of know the nervous system piece of it, fight, flight, freeze, fawn. And I think that there's an interesting conversation for maybe a future podcast, which is, should we be screening for trauma in our sessions? So I park that as food for thought. They talk about responding, and their 4th one is to resist re-traumatization. So when I created my little handout for the conference, I combined respond and resist re-traumatization together, knowing that we are responding with our trauma-informed principles around safety, collaboration and mutuality, cultural, historical, and gender issues, being trustworthy and transparent, inviting choice and empowerment. And then the 6th one is peer support, which I actually popped down into a different one of my R's. So we know those 6 principles exist in our responses. The pieces that I added on was I added 3 more R's, which were recover, resource, and refer. And I added those because even when we offer our best response, Oh, sorry. The other one was repair. I'm not sure if I said that. So the ones I have added were repair, recover, and resource, as well as refer. And we need repair because as good of a human as we can be, we're going to mess up. We're creating safer spaces. We won't create a fully safe place. So we need to be able to be resourced enough ourselves so that when we mess up, we can hang in with our client, do the repair, and reestablish that therapeutic alliance again. So this can look like making sure that we're doing our own personal work, as we talked about earlier. It means that we apologize when we make a mistake and we don't make it about ourselves. And that if we notice a change in the client, slow down enough to check in. Did I miss you? Give that opportunity for something. We can sense a shift in the energy. So I just want to check in. Did I miss something here? Because it's important for you to tell me. So invite the opportunity for repair if we think a rupture has happened.
Right. Yeah, I should do my quick repair for Allison and Wind. I forgot to mention their names, that they were a part of that talk that you did at Fall Voice. So we'll be sure to cite the talk in the show notes for everyone to see.
Wonderful, wonderful. And then the additional R of recover. This work is hard, right? This work is emotionally difficult. So we need to be able to take time to recover ourselves from staff interactions that have been challenging, client interactions, or our own personal challenges. Resource. I love the word resource because it has so many meanings, but in this context, it's talking about physical resources. Like, do you have a list of referrals ready for your client should they want support finding some extra help? It also means resourcing ourselves. So looking at what our internal and external resources are for ourselves so that we can show up for our clients. I'm a huge, we all talked about plant-based food, love plant-based. I love nature. I love breath work, mindfulness, and self-compassion. Those are some of my big resource tools.
And I love that you mention like nutrition as a resource for boosting resilience, because it is one of those things that can help with your resilience, or that we can abuse in terms of maladaptive coping. And I forget that a lot. And so, yeah, thank you for highlighting that. Even recently, I'm paying more attention to the talk about inflammation and mental health.
That gut-brain axis.
Yes.
Fascinating.
Yes.
Yeah.
That's a whole topic. I get that it's a whole topic, but yeah, I'm glad that you mentioned food as a resource to help build that resilience.
Yeah, it's one we often overlook, especially when we're rushed.
I was just gonna say, sometimes you don't have time to cook.
Yeah.
And the one thing that you can say about a whole foods plant-based lifestyle is that you need to have time to cook, because no one is going to do whole foods plant-based like you can at home. Restaurants don't do it well at all. I'm in a place now where I enjoy what I prepare at home better than what I can get in a restaurant.
Ooh, I think I need to come to your house.
That's why I started making stuff myself.
Yes. That's amazing, Geneva, because you're obviously a very good cook.
I am. My mom is a really good cook, and I've picked up a lot of tips from her. So I never think of myself as a really good cook because I'm always comparing myself to her. But it's true that I feel like I can prepare things that I enjoy more on my own. So like going out to a restaurant is more of a social thing for me than like getting a good meal.
Exactly. Okay, so Geneva, I'll be at your house in about 25 minutes. Gwen can meet us up with us in about 8 hours. I was just gonna say that I haven't been able yet to dive deep into it, but looking at some of the work about brain health, that nutrition and sleep are such a big part of it. And then all of our emotions and regulation, our capacities are built on brain health. And so the idea of whatever we can do to nurture that, which then feeds into all these other things, that sometimes if we don't address that, are we just constantly addressing the symptoms but not the root? So I'm glad that this idea of nutrition came in as well.
Yes. Yeah. And then the final R is
Yeah.
refer, because really it takes a village, right? So being able to recognize, when do we need support? Who can we refer to, and really create a stronger team for ourselves and for our clients? And that includes peer support. Do clients want to be referred to peers who have gone through similar experiences, who I think provide a level of support I just never could? So I'm a huge supporter around peer support. And of course, knowing, especially when we're talking about trauma-informed practices and trauma-informed care, knowing when you need to refer for crisis intervention. So I think every therapist, speech pathologist, singing teacher needs to have that skill set of knowing, what to be looking for. And then if someone is expressing signs of potential self-harm, going a little bit deeper and knowing, when do I need to make sure that this person is getting the services that they need.
Can you explain a little bit more about self-harm and crisis intervention, what that is?
Yeah. So if a client is sharing with me that they are thinking about hurting themselves, then I want to get a few more details about that. I want to know what that means to them. If that means that they are in imminent danger of hurting themselves, do they have a plan? Do they know what and I'm talking like a suicide risk assessment at the highest level of risk.
Mhm.
Because if someone tells me that they do want to end their life and they have a plan and it's very specific, I need, that's a limit of confidentiality that I cannot keep. So to be able to support them to get the help that they need. It doesn't have to be at that level, though, to intervene. If someone is sharing that they're feeling very low and depressed and they're isolated, would you like some help around that? Right? Again, always offering choice and empowering them to choose. But if they say yes, they would like help, well, what would that look like? I have a list of resources here. Can I offer those to you? Is there someone I can call on your behalf? Giving them choices around what a referral would look like for them.
There's so much around mental health that's very subtle, and that unless you've been around it for a while or have had specific training, you just often don't know what to say or what to do. So it's great to have a toolkit like what you created of resources. And like in the United States, we have a suicide and prevention hotline that people can call, and we'll certainly put that in the show notes. Because it's just a good resource to have for yourself and for people around you, clients, patients, in case someone is in crisis.
Yeah.
So as far as like referring, is that why you were mentioned at the top of the show about screening?
Yeah. Well, I think being able to, if we were to screen, and I think what I was thinking about when I've thought about this in the past was around the ACEs. Because we know trauma is ubiquitous, 7 out of 10 individuals is about the approximate stat of people experiencing something traumatic in their life, and knowing the impact that has on someone's entire well-being, including their voice. And if we reduce the stigma around trauma, if we normalize and help people ask these questions, then people feel support. And I believe that would then make our care more holistic. But yes, Geneva, it then highlights, like we would have a flag of, if no one's asking, no one's offering.
Right.
If more people are asking, more people are offering. And perhaps when the right person screens at the right time, that might be the right opportunity for that individual to receive help.
Yeah, I really like how simple it can be too. Like at my last medical visit with my primary care physician, she asked me just 2 questions to screen me for depression. And it was so quick and so easy. I was like, oh, that's it? She was like, yeah. I don't remember what the questions were, but it was super, super, super fast. Something about, have you been feeling sad for the last couple days? Something like that. And I'm sure if I had failed the screen, those two questions, if any red flags came up, she would have suggested that I see someone or made a referral. And the fact that it's becoming more common, even in primary care visits, to ask those questions or to ask, are you experiencing intimate partner violence? Just goes to show you like how important people are finally beginning to see that these things are. Because I just can't help but think how little I knew about this, as an emerging adult in my 20s, even
Yes.
as a young adult, in my 30s. I had no idea about any of this stuff. I just kind of experienced things and reacted emotionally to the things I was experiencing, not knowing that's a red flag, that's a red flag, be careful here, you know. So it's really important education for people to have. And it's important for the people that we go to for support to be able to kind of direct people who they don't have the training. So,
And if we had it in our universities more like just woven in to every course, then people would be graduating with it woven into their own practices. It wouldn't have to be something that, I mean, this was nowhere in my training.
right.
So I'm really glad. I hope it is. Do either of you teach at a university?
Not recently.
Okay.
I spent about 10 years in the university setting, but not, I'm private now.
Okay.
Yeah.
Would you say it was woven in while you were teaching? No.
No. In fact, as I'm looking at it, I can think of so many violations to this, because, especially working in performance, there's a lot of pressure to deliver, both for the singer, but also the people producing and, with their name on it. So sometimes that can bring out other things when ego gets involved, as opposed to this kind of lens. But as you're talking and going through all of these R's, I'm like, this would be good for like parenting. Like it's something that should be given right from the beginning. Can you imagine how families might relate to each other differently if these were kind of the guiding principles?
Absolutely. And I think, that's why I think trauma is becoming such a big topic in public schools, is to be able to support students and families, because children growing up in very stressful environments have a hard time thriving, being resilient if their parents are not coping. And who's teaching the parents? Well, we're teaching the students, but who's teaching the parents these R's, So, yeah, I 100% believe that it's good for parenting.
And this would be easily adapted, right? Like that handout that I created, it has sort of practical applications. You could totally fill that column out with what happens at home, at bedtime routine, etc.
Yeah.
Right. Speaking of that handout, to our listeners, Gwen has put together a really cool toolkit for trauma-informed care with the 4 main assumptions and the others that she added in. So we will link that in the show notes. You can click the link and get a copy of that. It's like a quick little cheat sheet, but it's just so resourceful and very easy to understand, so well organized. So we encourage you to check that out.
And then you can become resourced, one of the R's.
That's right. So moving into our last segment for today, we talk about a featured agentic practice. And everything that we've talked about today are agentic practices. Trauma-informed care is an agentic practice. But we'd like to know what you think is a featured practice that facilitates agency or freedom for people, for voices. Do you have one specific thing that you would like to share with our listeners today?
I would love to share one exercise that I'm really getting into these days, and I think of it as a bit of a mashup. So it's a mashup of mindset, mindfulness, embodiment, and easy onset. So easy onset is a voice activity where you are trying to soften how you're landing, especially on a vowel. So if I say Abby ate an apple, the vowels are having hard onsets, we're trying to smooth those out because it's a little less traumatic to the voice for people who aren't familiar with what easy onset's about. So this activity works on mindset first and mindfulness, because I'm going to invite you, or whoever is listening to this, to practice the phrase, I am so happy and grateful, I speak easily and effortlessly. Now, the key is you repeat it about up to 10 times, and then you notice what you notice. So let's just try it for like maybe 4 rounds. So I'm going to get you to just, I'm so happy and grateful, I speak easily and effortlessly.
I am so happy
Happy and grateful, I speak easily and effortlessly.
I am so happy and
And
grateful.
grateful, I speak easily and effortlessly.
One thing I want to check in on is, how did it feel? Did it feel easy and effortless?
For me, it felt good. Some of it was timing. I was a little distracted by the timing because of the Zoom lag. So getting away from that was the difficulty I had.
Yes.
What I was noticing for myself was not so much my voice, but just how like happy it made me to be expressing an affirmation of gratitude. So it affected my mindset and just my mood. So I didn't focus as much as on my voice.
Okay. Nice. And what I notice is when I do this with clients, especially those who have a voice disorder that requires them to strain to be heard, or they have muscle tension dysphonia where there's no pathology, but there is just a tension imbalance that's having them strain. The mindset piece is we will never outperform our self-image. So if someone's self-image is, I strain to speak, then that is something they are constantly working against. So by having the affirmation of, I am so happy and grateful, I speak easily and effortlessly, they are creating the self-image of somebody who speaks or sings easily and effortlessly.
I love that. I'm going to change that speaking to singing.
Yeah, it could be singing.
There we go.
Could be
Yes,
singing.
I love that.
And
That
then
is wonderful. Thank you for sharing that as an agentic practice. I don't think we've had anyone speak about affirmations since we started. I mean, we haven't had the podcast on a very long time, but it's a great affirmation statement. I love that.
The other thing I want to just dial into that, because it's important, is what was your observer doing? So if you were listening and you were thinking, this doesn't feel easy and effortless, am I doing this right? Notice the quality of your observer and just invite your observer to become more neutral. Can your observer just make space to experience and collect data and then play with the data? This isn't about getting it right. So if the observer can just be neutral and not critical or hyper-focused or hyper-vigilant, then you'll have greater ease.
I love that you said that, because one of my challenges with affirmations, like the ones that are published in apps, is like some of them are so fabulous, like I am wealthy beyond imagination. I'm the size and shape that I want to be, and have the lover I want.
Yes.
And I'm just like, really? I can't believe this is not credible. But so that's that critical observer, because I think if you do think it and believe it, you can certainly manifest it,
That's right. Yes, that's the whole key. It's not what you want, it's how you feel about what you want.
Right. I love that.
I like that idea too of allowing the language to energetically fuel your empowerment, to fuel a higher vibe, to talk a little woo, which I love. Because I think sometimes I've seen where, when I walk through some things with some of my clients or just in general, it can be very transactional. Well, I said it 10 times, and I think that there's another level of engagement with this kind of work where there has to be an energetic, emotional charge, kind of making space for that. Because I think the language and the emotion and the experience and the observer, I love that word, by the way, how they all fit together. So making sure it's not just, well, I put my coins in the slot, I should get something. There's a different kind of engagement here. So making space for that energetic or emotional experience.
Mhm.
Well, this was great, Gwen. Thank you so much for coming and for sharing all of these great nuggets. Do you have anything else you want to say before I close?
I am going to be doing a trauma-informed care workshop for practitioners. So if
Nice.
clients would like to go to my website and get some information or just email me, I'll let them know when that workshop is happening.
Can I
Great.
ask you a question about that? Is that virtual or on site?
It'll be virtual.
It'll be virtual. And is it specifically for SLPs, or would, what voice professionals would be welcome here?
Yeah, voice teachers, voice speech pathologists in general. I mean, it will have it will be that toolkit in a
Beautiful.
larger format, in a more relaxed, let's go through this and really break it up
Nice.
and digest it.
I love
Great.
this. I think I have some people I'm going to send your way. I'm
Wonderful.
going to sign up first.
Thank you. Thank you. Thank you. Thank you. I feel like I've made 2 new friends. It has been
Awesome.
so lovely to get to know you. And I really appreciate, you having me on and having the opportunity to have this discussion.
This is great. And Geneva, you know what this means? We have to take the podcast on tour so we can go and see Gwen and have some plant-based food with her.
Absolutely. Absolutely. These are goals, right?
There is an amazing restaurant in Toronto called Fresh, all plant-based, amazing.
Nice.
All
So we will
right.
go there.
We got to go.
All right, cool. For our listeners, in this episode, we discussed a trauma-informed care toolkit for voice professionals by Gwen Merrick. If you enjoyed today's content, I encourage you to subscribe to the Agentic Voice Podcast on your favorite podcast platform. Don't forget to leave a review or comment so that we know what you do and don't like. Your engagement helps our podcast grow. Until next time, take care.